Hi everyone, I'm Maike from the clinic certification team at MediHair. Today we'll explore the ins and outs of hair transplantation, the methods, costs and much more. Hair transplantation has evolved significantly since its inception in early 20th century Japan. Initially, results were unnatural, but by the 90s, techniques like FUE brought about a revolution, leading to the natural, minimally invasive procedures we have today. Before diving into treatments, let's understand the types of hair loss. Androgenetic alopecia is the most common, affecting mostly men. Alopecia areata creates patchy spots, and diffuse hair loss involves thinning across the scalp. Each type requires a unique approach. Assessing hair loss is crucial. We use the Hamilton-Norwood scale for androgenetic alopecia to determine its stage and also the future progression of the hair loss. This helps in planning the transplant, including how many grafts are needed and the potential cost. But what is a graft? A graft is essentially a piece of skin with hair follicles, usually taken from the back of the head. Most grafts have follicles that range from 1 to 5 hairs, with an average of 2 hairs per graft. In FUE, these are harvested individually, while in FUT, a strip of skin is used. Understanding grafts is key to grasping the transplant process. We understand that cost is an important factor when deciding on a hair transplant. However, we advise you not to base your decision solely on the price. Remember, this is a permanent solution, so it's an investment in your long-term appearance and confidence. Costs vary by method and location according to our hair transplant cost study. For example, FUE costs average $3.22 per graft in the UK and $1.07 in Turkey. Canada had the highest average total cost at $17,500 with Australia closely following at $13,700 and the US with $13,600. Turkey has one of the lowest average costs with $2,675. There are several hair transplant methods. The most common technique is FUE. FUE involves individual hair follicle extraction, typically at the back of the head. The second method is DHI. The DHI technique is similar to the FUE technique when it comes to harvesting the graft. However, the grafts are then implanted into the recipient area with an implanter pen without the need for prior creating recipient sites with a fine blade. The third method is FUT, short for follicular unit transplantation. FUT differs from the FUE method, especially in the removal technique. Here, a whole strip of hair is taken from the donor area and then fragmented. Therefore, this procedure is often known as the strip method. The implementation is similar to the FUE method. There are 3 factors determining if you are a suitable candidate. First, the healthy donor area. A successful hair transplant requires a healthy and thick donor area. Androgenetic alopecia, a common hair loss type, is best suited for transplants. Age matters. Very young patients are cautioned due to unpredictable hair loss patterns. We typically advise patients to wait until 25. Your family's hair loss history is also crucial. And third, hair loss state and progression. The less hair loss you have and the more stable the hair loss is, the more likely you are to be a candidate for a hair transplant. However, you may consider medications such as finasteride to stabilize your hair loss. Hair transplantation may also be a solution for a patient with severe hair loss, a Norwood type 6 candidate if he has the right expectations. Individual hair characteristics greatly influence transplant success. For example, curly hair creates a more denser look after a hair transplantation. All in all, realistic expectations about the results are essential. But what are the risks? While hair transplants offer a sustainable solution with minimal maintenance, they're not without risks. These include potential infection and minor side effects, but with a skilled surgeon, these risks are considerably low. A transplant takes 3 to 7 hours under local anesthesia. Aftercare is crucial for success, involving gentle care and avoiding certain activities such as exercising to ensure optimal healing and hair growth. You will start seeing results within 6 to 9 months, with full effects visible after a year. Initial shedding in the first month is normal, so don't worry, it's part of the process. Choosing a hair transplant is a big decision, but it doesn't have to be daunting. Our guide aims to demystify the process and help you make an informed choice. Remember, a detailed consultation with a specialist is essential for a successful outcome. You can read our complete hair transplant guide at medihair.com.